Thank you very much. Professor Charles Rupprecht, nice to talk with you again and start. So the first question I want you to clarify is, could you please introduce the current progress in the control of rabies?
Yes, thank you, sir. That's an excellent question. We've really progressed over the last 50 years or so in terms of how we think about rabies, in terms of education, as far as surveillance with laboratory enhanced surveillance today, and most importantly, in terms of our prevention and control. And so rather than thinking of in the past receiving nerve tissue based vaccines for humans or killing animals as the primary means for control, today we have excellent modern human cell culture vaccines as well as for domestic species. And this combination of human prophylaxis as well as mass dog vaccination have really become the foundation, the cornerstones for a modern program towards the elimination of human rabies by mass vaccination of dogs. Hopefully, by a program considered by jointly the FAO, the OHIR, and the WHO, there's a global vision for the elimination of human rabies by the year 2030.
Thank you. So I'll follow with the next question. What is the One Health approach in rabies research or rabies control?
Thank you. The One Health approach really looks at both the pathogen, the hosts, and the environmental interactions among them. And so from that standpoint, we're not just thinking about vaccinating people, and we're not just thinking about vaccinating dogs, we're thinking about a whole risk approach to the concept of this zoonosis, rabies, for prevention in humans and domestic animals. And in addition, we have the ability to vaccinate wildlife. So through this combination of all the major hosts that are at risk, by doing risk assessments on people who are potentially exposed to suspect rabid animals, and by vaccinating those domestic animals at risk, importantly dogs, we can, in a One Health context, not only manage the disease in one species as a public health problem, meaning humans, but also from the standpoint of the reservoirs, domestic animals, and wildlife. Importantly, that concept of oral vaccination of wildlife can also be borne onto the problem of free-ranging dogs, and by using vaccine-laden baits, we can make it even easier to reach that component in dog populations and vaccinate them not only by needle and syringe, but also by offering such dogs that are difficult to vaccinate by hand through vaccine-laden baits. This is really the epitome of the One Health approach towards prevention and control of zoonotic disease like rabies.
Yeah, if I understand you, the One Health approach means bringing stakeholders of diverse background in controlling rabies. And you will agree with me on this part of the world, bringing those people together is very difficult. So how are you handling that in Africa?
Excellent question. And the challenge in both Asia and Africa is to make sure that all the stakeholders are at the table, not only those in the Department of Health or in those in the Department of Agriculture, but also those in the environment or wildlife component as well, using the strategies of at least all three of these components really is the key to having a successful prevention and control program. And similarly, we need to have champions in each country that will be able to understand and apply this One Health concept, not only to rabies, but really many zoonotic diseases in the same way.
Yeah, thank you so much for the answer. But also in the One Health approach, there's something you call SAR approach, which is very new to a lot of the stakeholders. So what does this involve?
Sure, thank you. The SARE really is talking about a risk assessment. It's the strategic approach to rabies elimination. And what it does is look at a 5-point scale, and 0 would be that particular scale where a country's very early on in its methodology. They don't really have a national program. 5 on the other end of the scale would be that approach that has led to the successful elimination of human rabies caused by dogs through human prophylaxis and mass dog vaccination. In some cases, that 5 would also signal not only the elimination of human rabies, but really ideally the elimination of that particular virus that causes dog-to-dog transmission. And then everything in between is really looked at in a stepwise manner, from starting from ground zero all the way up to eventual elimination, and a 2-year program towards that certification to verify that you have actually eliminated canine rabies transmission to humans in this One Health approach.
Yeah, the One Health approach, is it making any impact? We are still on the second question. Is the One Health approach actually making any impact different from if we had controlled rabies as before?
It's an excellent question. Yes, we feel that this One Health approach really has made an impact in terms of this disease. Number one, all developed countries have eliminated canine rabies. Number two, increasingly, as we've shown regionally in the Americas, developing countries in North, Central, South America are increasingly moving towards canine rabies elimination. We can have the example fairly recently of Mexico, that became one of the most current countries that have validated the elimination not only of human cases caused by dogs, but actually by dog rabies. This was because in 1983, the Pan American Health Organization looked at the Americas as a unit, both developed and developing countries, and really made the foundation for One Health by mass vaccination of dogs and by risk assessments of people who are exposed to those dogs. And so we see increasingly from a regional perspective that this One Health concept is actually working. Similarly, if we go ahead and look throughout the world in Asia and Africa, recently in India, the first state, Goa, became the first state in India that had dog rabies, and using this One Health approach, particularly instrumentally with a partner, an NGO, Mission Rabies, Goa became the first Indian state in Indian history that was endemic for dog rabies, and now is human and canine rabies virus free. This same kind of approach that we've seen regionally in the Americas and increasingly being applied in rabies and zoonotic countries, such as we've seen in India, really need to be applied also in Africa. And we hope that there'll be additional countries in sub-Saharan Africa in particular that will be able to use this stepwise approach and move towards rabies elimination by 2030. It's a great model, and we hope it can be used in that concept to move towards human rabies elimination caused by dogs.
Thank you. That's excellent idea. But as you indicated, we hope to see it work in Africa, because it seems various departments, various agencies are still standing at their sale, because they are thinking of the financial gains they are going to lose to other One Health partners. Because here you have the health service receiving all the money for rabies control, and then the veterinary who are supposed to stop the rabies from getting from the animal into the humans have nothing to be proud of controlling rabies. So it's a good idea, and we hope the One Health will continue to be spread around the world, and people would actually take the opportunity. It's not
That's
only
a great,
yeah.
that's a great point that you just made, sir, in that if we're honest, rabies is a public health problem.
Yeah.
And by and large, conceptually, we don't eat dogs the way we eat livestock. So there's less of a financial incentive from an agricultural department to look at rabies seriously. That was the reason why the Pan American Health Organization that began in 1983 recognized that rabies was a public health problem. And from that standpoint, that One Health concept of working together by intersectoral cooperation really was famous. So countries, whether in Asia, Africa, or in the Americas, when they form that team, have to look at this political reality and how you're going to budget appropriately, because otherwise there's not an incentive on the basis that the funds that each of those departments get. So rather than thinking of that individually, we need a One Health concept politically in terms of how we think about a new paradigm to disease prevention and control, not thinking about it in the same old ways.
All right, thank you. We have a goal of zero human dog-mediated rabies deaths by 2030, a very ambitious one. What are the urgent steps for us to do that at the current stage? Can we make it? Thank you.
We're at this all the time in terms of schedules, and rather we look at it as a goal towards this is what we should be moving towards. We also have to be realistic that the COVID-19 pandemic has impacted all of our realities, neglected tropical diseases, etc. Rabies is just one of them. And so everybody is reeling from the impact of the pandemic, that slow progress that had been made. And we hope that once we can control one major pandemic, that we'll be able to get back to business and start applying this reality. We also have to be honest. Can we use new tools? Sure. Research and development are always great. Do we need new tools as an excuse to begin? Absolutely not. All the tools that we need to understand how to do laboratory-based surveillance, how to vaccinate dogs en masse, how to go ahead and immunize people who've been exposed. All of those fundamental tools, the understanding of this disease, the educational component, all of these are 20th century tools. So we can't use the excuse of, oh, we need something better for tomorrow to start to begin. Rather, we have everything that we need to begin now. What we need is that enthusiasm, that political will, those local champions, and recognizing this as a goal to move towards rather than as an absolute mandate. Otherwise, what happens, whether it's DRC or whether it's Ghana, or whether it's Ethiopia, what happens if you don't achieve that goal? We recognize these are goals to move towards, and that if in fact one can't, one doesn't, then we reassess the rationale for why that wasn't able to meet those criteria, and we move on with additional goal setting needs. It's a very realistic question. I thank you for that.
Yes, and that is why I'm thinking, because some are far behind, some are far ahead, some have even completed. So yes. How are we getting all these groups to the 2030? Especially in Africa, where it's so endemic, and some people are just initiating. They are just starting. They are at the lowest level of the SARS.
That's absolutely true, that some countries in Africa are further ahead than others. Some have not even started. So we have the entire spectrum in African countries. We have to recognize this. And it's also one of the issues of, from a regional approach, as some countries meet that goal, reach that goal, assistance regionally to others in that area. So for example, if we think in the Americas, we have the issue of Bolivia, which is a rabies endemic country. Well, having dog rabies in Bolivia impacts all of those surrounding countries. So even though the surrounding countries, for example, Argentina, may meet the goal, they're still going to be met by having a source of canine rabies from that particular place to all the surrounding areas. So it behooves surrounding countries from a regional approach to assist others that are not further ahead on that goal. This is one of the reasons why there's been a move towards a pan-African model to try and deal with rabies and meeting this particular goal by 2030.
Exactly. Yes, exactly. I was coming to that because what is used to control rabies in other parts might not apply in Africa. So there should be something different. Don't you think so?
I think that African investigators need to deal with African realities. And those realities are what's on the street, what's going on in the field. having said that, the questions of what's causing rabies, let's also be honest. Dog rabies is caused by dog rabies virus and maintained by dogs. We know that we can eliminate dog-to-dog transmission. That's not going to vary whether it's in Asia, Africa, Latin America, etc. That's a reality. How you do it, how much it costs, how many dogs there are, that may vary, but also the question of how many dogs are there. There are many ways to enumerate animals, whether we're talking about lions or whether we're talking about elephants or whether we're talking about dogs. There are tried and true methods to ask that question and to answer it. Similarly, it's not going to vary what proportion critically, theoretically, we need to vaccinate in a population. That's been answered. The same questions about what kind of vaccines do we need to use in people or dogs? That's been answered. How do we diagnose rabies? That's been answered. How you put all those tools together, how you make sure all those working parts are working smoothly, how we engage community leaders to do that, that certainly is going to be relevant from an Afrocentric point of view. But the science, the epidemiology, the pathobiology, all of these things we understand. If we look at just applying those tools, there's been great progress in a country like Malawi, because you take those fundamental principles, you apply them, you do mass vaccination of dogs, and you can show that by doing either house to house or central place, you can vaccinate dogs, have an impact on human rabies, and move towards that goal. How we get everybody working together towards that and be able to explain these things and in a cost-effective manner, move towards this goal, that's going to be the challenge from a continental perspective.
Good, thank you. You show particular interest in local practice and rabies prevention, control, and treatment. What do you think of the main gaps in these regions?
Excellent point about gaps. Although we always need research to improve the way we do things, there are really no major fundamental gaps. If we say that there are gaps, the greatest gaps are socioeconomic. The gaps are, how do we think of the most equitable socio-political way to work together? And probably most challenging, how do we go ahead and pick ourselves up from the reality of the pandemic and move towards dealing with neglected tropical diseases like rabies and moving forward? There's always going to be pandemics. There's always going to be challenges. There's always going to be alternate priorities. How we can go ahead and look at the gap of dealing with rabies versus other zoonotic diseases and other challenges and making a priority to move towards a goal, that's probably the biggest gap. I don't know how to go ahead and infuse enthusiasm into individuals. I don't know how to go ahead and have interest to be rabid in transmissibility to demonstrate that this is achievable. That, you know, there is no new magic bullet needed. We know how to do this. There is a toolbox. What I don't know how to do in terms of a gap is how to go ahead and, the same as you and yourself trying to enthuse folks in Ghana. How do we get people excited to do the right thing for a social good? It's probably not a technical gap as much as it is a social gap.
Yeah, difficult, isn't it?
Yes, sir. Otherwise, we wouldn't be having this conversation.
Yes, another chip-in question. What accounts for the low attention that rabies receives in the sub-Saharan countries? What do you think? I'm from sub-Saharan Africa, but I think I would like to take your view on this as a global champion.
That's an excellent question in terms of why do we have a lack of priority for zoonotic diseases like rabies? Part of it is a cycle of neglect, in that we need to have adequate surveillance to know what the caseload is. In the past, it wasn't so easy to diagnose human rabies cases. We have a variety of laboratory tools to do that. So if you don't have the caseload, then you don't have the priority to say, well, it affects this number of humans. And without having that caseload, it goes back to looking at prioritization of funds. Then there's no prioritization for prevention and control, and hence there's no application towards enhanced surveillance. So we have a cycle of neglect that may go to how we prioritize diseases. Number two, since dogs aren't thought of as a commodity the same way as we think of livestock, there's nobody who really cares for these free-ranging or community dogs often, so we don't have the same degree of impact or prioritization from an agricultural standpoint. Thirdly, oftentimes we know that progress in rabies can be tied to the Human Development Index. It's a socioeconomic reality. And so the people who we see most often affected are the poor. And we know that the poor socioeconomically around the globe, whether it's in the Americas and Africa and Asia, we have disenfranchised individuals. We have health disparities. So it doesn't matter if we're talking about rabies, malaria, TB, etc. We're always going to have the voiceless poor. This is part of the complex socioeconomic social reality of how we do or don't prioritize infectious diseases like rabies. Highest case fatality of any infectious disease, killing large numbers of people and animals, and yet we don't seem to have been able to prioritize these for the public good. We also have to recognize that for a relatively small investment, we can have a relatively large benefit. That is, if we think about the relative cost of dog vaccination, it pales in comparison to the relative costs of human prophylaxis. And both of those are certainly much less expensive than when we have an actual human case. Start thinking about experimental treatment, or what do we do with grief counseling when we have that impact in any family, when we have a death of a family member that's otherwise preventable. It's also difficult to put a face on rabies because we don't have a poster child. It's not like, for example, polio or the March of Dimes, where you have paralyzed children in neighborhoods that are a constant reminder. When you get rabies, you die. And it impacts those poor people. And those are voiceless, faceless people that we can't remind our political leaders, this is who we need to reach, this is who we need to protect. It's for all people and all animals at risk.
Yeah, that is a good answer there. But my old man in the very deep village is always asking me, why is it that we are getting treatment for all diseases? What about rabies? How far have we gone with the progress in treating human rabies?
I wish we could say that we were further along on treating human rabies, but considering that it's an acute progressive neurologic disease, oftentimes when it presents, if somebody's bitten by a rabid dog and we have signs that are consistent and the incubation period is also compatible, then the diagnosis is easy. The problem becomes when the individual doesn't recognize that they were exposed, say from a minor bite or a scratch by a dog that they may have known. The dog disappears, probably died of rabies, and now you have an incubation period several weeks to months later. The individual develops encephalitis. If that's not recognized as classical, meaning with hydrophobia or aerophobia, now days go on before we even have a recognized diagnosis. So we have delay and problems in recognizing that it's rabies. 2, where's the closest major health center that is going to be able to have intensive care support? And then 3, where's the center of excellence to be able to confirm by laboratory means and be able to monitor that patient over time? And lastly, the issue about prognosis. It would be ideal if we could treat all individuals with rabies all the time. The reality is the prognosis for individuals, depending upon their relative age, other health conditions, the surrounding supportive environment in the hospital, the available tools that are there, the monitoring, the issues of the increased cost of treating a single rabies patient, the ethical dilemma associated with the same versus the relative costs of vaccinating a dog. The costs are incomparable. It creates the horns of an ethical dilemma of prevention as opposed to being able to treat. It is always going to be more difficult to treat an acute progressive encephalomyelitis than it is to be able to prevent it from ever happening in the beginning.
Thank you. Any message, take home message, especially for we who are still trying to eliminate rabies. Any message for us, please?
I think at this point, keep the faith, maintain the enthusiasm, look to the tools that we have on hand, maintain being champions. Is very, very difficult. I understand that. Whatever others can do to help assist, whether it's in Africa or in Asia, whether it's in Ghana or in Ethiopia, there are people willing to help. We need to all be in this together to meet that ZBT 0 by 30 goal. And certainly we thank very much for your enthusiasm and continue doing a good job.
Thank you so much. I think we take inspiration for people like you, and we'll continue to fight rabies. Thank you.
Thank you, sir. Appreciate your attention and ability to take some time today and to ask these questions and stay involved. I appreciate your enthusiasm.
You're most welcome.